Yeah, Megan, the vaccine, it is a critical tool that is a safe and effective way to fight and wipe out infectious diseases like smallpox and polio. Vaccines are not new, but the spread of the COVID-19 has raised concerns about them and, unfortunately, some hesitancy to take the shots.
Mask wearing, distancing ourselves from family and friends. Just a few of the changes we've made in our lives during this pandemic. But it's not the first. Before 2020, there were 4 influenza pandemics that made it to U.S. shores. The 2009 H1N1 pandemic originated in this country, and vaccines helped bring them under control.
So classically, we've been doing vaccines for centuries, but they didn't really start getting popular into the 20th century, and things related to things like polio were some of the earliest ones to do.
Dr. Galen Marshall is the executive director of the Mississippi Clinical Research and Trial Center at UMMC. He tells me that the road to vaccine development historically is a long one. It could take between 10 and 20 years after an infectious agent is identified for researchers to develop the technology to stop the disease.
I then look at it in a test tube, and then I look at it in an animal model. All that takes time. And then I go to start looking at it in people in what they call clinical trials.
The goal is to make sure that it's safe. Dr. Marshall says government, scientific researchers, and competing pharmaceutical companies came together during this pandemic in a way he says was nothing short of miraculous.
And they all realize that, you know what, we've got to pool our resources and pool our efforts, or if we don't die, our friends and loved ones are going to die, because we've got to do something about it, and they did it.
There have been decades of research and study into the structure of viruses similar to COVID-19, so researchers were able to build on the data they already had. The Moderna and Pfizer vaccines were developed, and New York nurse Sandra Lindsay was the first American to receive the shot on December 14th, 2020. But a vaccine is only effective if people are willing to get it. It's not making its way to people of color, the groups dealing with the most risk to COVID-19.
The determination of whether the vaccine is safe and effective is not made by the federal government. It's not made by the company. It's made by an independent data and safety monitoring board who is beholden to no one.
Dr. Anthony Fauci speaking during a forum earlier this month hosted by Tougaloo College. State health leaders say they're working to get past the medical mistrust and create more access to the vaccine.
People just don't know that it helps. It helps with the pandemic and everything else.
The National Institute of Health is working in Mississippi with its SEAL team. SEAL stands for Community Engagement Alliance. The goal is to address mistrust and miscommunication about the vaccine.
It's kind of scary to think, that I'm trying to prevent it, because, I don't know what's in, what goes into the vaccine.
What's exactly in that vaccine? What exactly are you putting in it? There's the kind of common misconception that there's a chip in there, that there's nanotechnology, and we've heard that it may affect your future reproduction for younger participants.
The goal is to address mistrust and miscommunication about the shot.
None of it's true. None of it's true. And they have been debunked over and over again by really good science.
Now, there is still a gap in who's getting the vaccine. State officials say just 23% of Black Mississippians have gotten the shot. So what happens after this pandemic? Dr. Marshall says we could face another worldwide virus again, but the way future vaccines are developed could be forever changed by how the COVID-19 shot came about in less than a year. Troy Johnson, 16, WAPT News.